I mean, delegate to the Brennan chief.
Whatever.
Okay, I'm going to go ahead and get us started going through introductions and updates. I mean, I think we all mostly all know each other, but if you have something that you'd like to update us with, I've allocated about 20 minutes for this. So please, if you or your neighbor feels the desire to wax way eloquent, consider trimming it back so we can all get it in,
Okay.
in the 20-minute time frame. I know we often have a lot of people on this meeting. And I'm going to start with Chief McCurd.
Oh boy, updates. Busy. That's all I can say. We're really super busy. Dr. Carlbaum keeps us on our toes, makes us do everything we have to. It's really been a behavioral mental health month, and not just from the call perspective, but just learning and training. And we did some helicopter things, and so it's been just a busy time. And it's nice to start getting back together and do face-to-face. We're having several meetings that are face-to-face, and so thank you to all that are having some face-to-face meetings, and we continue carrying on our way with Zoom. So, and be safe out there. A little bit of rain today. And you want me to hand it off to somebody else?
I'll do it just because it's easier to keep track of who has gone, if you don't
Okay.
mind.
I'll shut up
Thank you
now.
so much. And it is good to hear that we're starting to do face-to-face. I can remember when the pandemic first started, I couldn't imagine how I was going to be able to do this whole project without being able to talk to people face-to-face. So it's amazing that we've kept it going. Thanks to all of you guys and your engagement. I'll pass it off to Patrick Johnson.
Oh, yeah, good afternoon, everyone. It's always good to see you. We've had, I'm with NAMI Jefferson County. We've had our support group meet in person. Our board meeting on Tuesday was actually Zoom because it works just a little bit better for some people. I expect that what will happen is that our future support group meetings on the first and third Wednesdays of each month at 7 in person at the Recovery Cafe will also be hybrid, because that way we're able to reach some people that otherwise would not be able to come. Sheriff Knoll reminded us at a meeting that we were in at the early part of the month that May is Mental Health Month. Of course, as all of the first responders here know, every day is mental health. And thank you to all of you and all of the good work that you're doing. It's a huge challenge. So glad to be here. Always good to see all of you. And thank you, Lori, for your good work.
Thank you. It's good to have you here, Patrick. Thanks for that update. Dr. Carlbaum. Oh, well, let me skip Dr. Let me come back to you. Chief Sheriff Knoll.
Well, hello, everyone, and thanks, Patrick. That made me feel good, all the stuff you were saying. But I don't really have much to report other than we did the drug take back 2 weeks ago, I think. Didn't do a whole lot, but I wanted to, but it was still good. Dr. Carl Bond was coming around to he was checking on us to make sure we were really there. And no, he came down to say hi. That was really nice. And I just wanted to tell Denise, Andy Pernsteiner, the undersheriff, we were short staffed that day. So I was down in Brennan and then, Quilcene, and then the deputies shared going to the QFC at Hadlock. When Andy sent out the email looking for people to do that, he said, yeah, you'll get to hang out with a really cool lady. And I didn't tell anyone that you weren't going to be there because I thought they may not come, but hopefully Andrew did okay. So you're missed.
Poor Andrew, all that free billing. Dr. Carlbaum.
Yeah, I just want to say thanks to the team at Quilcene, Anya, and Sheriff Knoll, and a couple other folks, Chief McCurn for hosting. Passed out 11, I think, is that what I heard? Leave behind Narcan kits. That's totally awesome. Awesome for just a soft start. I was fascinated to see people's reaction a couple times. The few folks I saw there about like, oh, maybe I don't need this, and how Anya and folks were able to talk them into it. Big news from my point of view is we need to start doing some collaborative training on the behavioral health patient care protocol that we now have for EMS. And so I'm working with Jim. Hopefully the first round of training will be in Quilcene on June 4th with Chief McCurn kind of honchoing that and hopefully trying to see who from Jim's team can come. We have some cases that we use in the Behavioral Health Summit that we'll use that are not easy to challenge people. And then Sheriff Noel, I'll be reaching out to you to invite any deputies that are working that day to swing by be doing that. And I think maybe some other trauma training that they could also benefit from. And then I need to work with the Port Townsend Police on doing some collaborative training also. And I was trying to think, I was brainstorming maybe like morning coffee clutches with coffee and don't be offended, maybe pastries or donuts or something, you know, so.
I was going to say, maybe donuts.
Maybe donuts. Judd Haynes.
Thanks, Lori. Now I want donuts. So Judd Haynes, navigator with the Port Townsend Police Department. Really no great updates, just kind of responding with law enforcement or by myself to mental health, behavioral health related calls. Today, I always enjoy this, got to meet with someone from a local organization to talk about de-escalation strategies. I was able to produce some journal articles about it that really kind of support a lot of the evidence-based work that's gone around kind of de-escalation. So I know I'm trying to make it sound cooler than it probably was, but I really enjoy that. And yeah, I don't think I have really any other interesting updates. So
Well,
that's
we're
it.
really glad you could be there, and it does sound very cool. I think everybody should nod if you think what Judd's doing is cool. Yeah, okay. See. Denise Banker.
Hi, I'm Denise Banker, and I'm the Jefferson County Community Health Division Director, and I used to be the Empowered Teens Coalition Coordinator for the Chimacum School District. And that's what Joe was talking about at the drug take back, because I'm the one who wrangled him into that in the beginning. And so, yeah, I think it's great that we expanded that to Quilcene and that Anya was there handing out Naloxone kits and talking to people about substance use prevention in a sort of intervention type of way. So appreciate that. We are scrambling over here with the news that the MCS counseling has pulled out of the school districts in terms of providing counseling in the year 2022-2023 school year. So have been working with Scott Mauk and Ciela Meyer to see what we're going to patch together for that. But that's what's going on over here.
Thank you, Denise, and thank you for being here. Kelly, and Kelly, I see that you have to hop off quickly too. So we'll try to do all the important stuff first.
Perfect. Yeah, thanks. Nice to see everybody. Kelly Parcher with AL 360. New updates, maybe just some information. I'm not sure that we're quite in the new phase, but we are taking steps towards opening up a youth, young adult community resource center, drop-in center, how that kind of title and how it fleshes out is to come here shortly, but we're in the process of seeking some commercial space now in our community to make that happen. So more to come.
That is exciting and much needed in this area.
Yeah.
Anya.
Hi, everyone. I'm Anya Callahan, and I've been working with the Behavioral Health Consortium on a community action plan around harm reduction. And I'll give you more of an update later about our recent drug take back event and some upcoming opportunities.
Thank you. Leanne.
Hi, I'm Leanne. I am the program manager for the REAL program. We've had 2 policy coordinating groups in which we discussed collecting all the navigators and having a discussion. So we've sent out a doodle poll for the navigators. I'm partnering with Tanya Barnett from the YMCA to get that coordinated. And then soon we'll be starting our operational work group. So we have a couple things coming up, and the team has been out in the field quite a bit and making connections through referrals from either the sheriff's navigators or healthcare navigators or family navigators, or primarily, and then individuals actually directly calling and wanting to be engaged with the REAL program themselves. So, following a process and a protocol of how many individuals and what we can take on with limited staff. We have 4 staff members, so a lot of referrals are coming in. So that's a good thing.
That's a good thing. We're so happy to have this program in its take phase and excited to see how it really gets integrated in. Dunya.
Hi, everyone. Dunya from Jefferson Healthcare. Just a lot going on right now. I came back from a week and a half vacation, and right before that, I was in DC doing some advocating for rural healthcare and hospital policy. So that was fun. So I am currently just digging my way out of an inbox that is very, very full. So glad to be here. Thanks all.
Glad you could be here too. Matt?
Hi, I'm Matt Reddy. I'm one of the Jefferson Healthcare Public Hospital Commissioners, and don't really have anything specific to report on, but glad to be here. Glad to see everyone.
Good to have you here. And Colleen, thank you for joining us.
Hi, thank you. So a lot of you know me through Jefferson Healthcare, but I'm not here representing Jefferson Healthcare. I wear two hats. I'm here representing Jefferson County EMS. So I am the Jefferson Healthcare EMS training coordinator for the county. So I work very closely with Dr. Carl Baum and the chiefs and kind of corral the cats, as we say, make sure that the paramedics and everybody is doing what they're supposed to be doing or not. And so my goal is to get the training going, and I think they're really gung-ho on this and want to do the right thing. So we're excited to take this adventure. So, and I'm excited to learn a little bit more because it's going to help me in my role here at Jefferson Healthcare, being part of the behavioral health team here. So I'm really excited to be part of this. So thank you.
Thank you.
I thought you wore about 5 hats.
Maybe a couple. So.
Thank you, Colleen. Apple?
Hi, everybody. I'm Apple Martin. I'm the director of Jefferson County Public Health. Nice to see everybody. I guess a brief update with all things behavioral health and what that means with regard to what we do. Well, we're still in the business of COVID. Things are changing still, as you're aware. So we're interfacing with that on all kinds of levels, including the behavioral health complexities of cases and their families and contexts. It can be complicated. Let's see, some other areas that we're, really kind of hoeing some new ground in. We're working more toward climate change and health, the intersection of climate change and health. And what's been really fascinating for me as a new leader is really to see how both our community and family health services and our environmental public health services, which are very different, but also under the umbrella of serving the public's health, where those intersections cross with regard to climate change. And I'm developing, more vast knowledge about how, especially environmental health, which is not my area of expertise. I'm a nurse, so I am more of a community and family health person, but where in environmental health, behavioral health is really, really, it's a thing to invest in with regard to folks who are struggling. And having that sort of vocabulary and awareness around behavioral health topics and issues in the sort of environmental health employee is something that they want to really expand and learn about so that they can have a larger repertoire of ways to interact with folks in the public who really struggle with a lot of the environmental health policies and codes and enforcement. So we're working on that quite a bit. Another feature, just quickly, is that we're endeavoring to work more intentionally around diversity, equity, and inclusion. And that always is something that, it's going to be a very big process and it's going to take time. And we're really thinking about that critically. We're getting a start on it more than ever. And I feel like it's going to inform our staff in ways that are obvious about diversity, equity, and inclusion, but will speak directly or indirectly to behavioral health topics as well. So that's what we're doing, among other things.
Thank you, Apple. It's good to hear what's going on there. How about Brian Richardson?
Hello, everyone. Brian with Deaf House Recovery Cafe. We've had and are having an exciting month. We had our first open mic of 2022 last Friday, which was a lot of fun. One of the things that we're trying to do is foster drug and alcohol-free pro-social events. And that one was a success. We've also been bringing in some local practitioners to provide other forms of healing and services. So we had someone come and do chair massage last week, which a lot of our members don't have access to. They can't either afford it or don't have transportation to get to it. And then this week we'll have someone come and do Qigong. So it's like both times to build community and access some of these healthcare services that they wouldn't otherwise get. And then next Friday, we have Leanne from the Real team come in to present about harm reduction. And that's open to the public, really does benefit, especially our member leaders and volunteers, to help us get an understanding of recovery issues that impact the members who come here and develop skills to support our own and other people's recovery as well. And we also started our third weekly meal. So we're doing meals Wednesdays, Thursdays, and Fridays. And we have this all on our calendar on the website, but we're excited about that and hope that that can help us access or provide access rather for more members to get involved. That's that.
Well, we really appreciate the incredible work you're doing and that you have been doing. It's nice to see it starting to expand now as the pandemic is lifting. Lindsay Skell.
Hi, Lori, thanks. And hi, everyone. My name is Lindsay and I coordinate the Empowered Teens Coalition in the Port Townsend School District, and that's funded by the Community Prevention and Wellness Initiative. And I guess my update is we're really wrapping up a lot of our spring programs, Guiding Good Choices Parenting Program. We also hosted the Drug Take Back event in Port Townsend. So thanks to everyone. And of course, Chief Olson of PTPD for being the law enforcement presence there. And we're entering an assessment phase for our grant. So we'll be working on assessment and action planning for the 2022 to 2023 school year. And yeah, thanks to everyone for being out there doing what you're doing, and happy to be here. Thanks, Lori.
Good to have you here. Thanks, Lindsay. Gabby.
I'm Gabby Cuddle, I'm the clinical supervisor, Believe in Recovery, and also run the RSAT program in the jail. We are just busy getting our mobile SU soon from Department of Health about getting that licensed. I think the only thing left we have to do to it is wrap it. Other than that, I'm excited to keep moving forward with that. Have some more exciting things on the horizon.
All right, thank you, Gabby. Jake Davidson. I'm not sure why, because it doesn't look like you're muted, but we can't hear you. Okay, all right. Thank you for trying. We're glad you're here. Thank you for being here. So we're at 3:19. I'm trying to see who else. Who have I missed? Cherish.
Afternoon, everyone. I'm Cherish Cronmiller, Executive Director of Olympic Community Action Programs, your community action agency for Jefferson and Callahan counties. The most important update is that in Port Townsend and Jefferson County, you want to send people to our Sims Way address. That's 2120 Sims Way, where we're located right next to the Verizon store, or where Roadhouse is located. It's in the McPherson office building. That's where you want to send folks who potentially need services who can't call in to make an appointment. So if they've got to come in to make an appointment, that's the location. You no longer want to send anyone back into the business park for any reason, unless you're coming to use the conference room or something there. There's no reason for anybody to go back to any of those buildings back in the business park. So, so for all of our partners, our administrative office is going to be moving next to the housing office space there in the McPherson building too. We're taking that corner spot that wellness or health place had. So that's where we're going to be. So ideally, people call or go online to schedule an appointment for services, because we're trying to move to that appointment-based system. But if they need to walk in to make an appointment, that housing office is the space to do it in, where we have interview rooms now available, and should have interview rooms available in the future for our partners as well, to be able to schedule to utilize if you need that space to do that too. So, so I think that's the most important update at this time.
Well, thank you. I'm glad you were here to tell us so that we make sure we get people funneled in the right direction.
Thanks.
I'm going to go to Lisa Thomas, who will introduce herself and also pick up the first part of the program, which is on Roadmap to Recovery. Go ahead, Lisa, and when you're ready, I'll share your presentation.
Oh, thank you so much. I always get nervous when I share my screen because sometimes it goes black. So thank you, Lori. So I'm Lisa Ray Thomas, and I'm with the University of Washington Addictions, Drug and Alcohol Institute. I also work with the American Indian Health Commission of Washington State. And in addition to what I'm going to share in a sec, the reason I was late, I'm super excited about in my role at ADAI, I get to work with and network with different organizations around the state, and including other opioid, SUD, behavioral health coalitions, task forces, and stakeholder groups like yours. And we had our first statewide meeting of different coalitions, task forces, and stakeholder groups from around the state right before this one. And good work's going to come out of that. So networking, like the great work that you do, you can share with somebody who's newly a coalition or having a challenge with something. Yeah, super excited about that. So thank you. And go ahead, Lori. I'm going to stop the video so I can see the screen.
Can you see it okay?
Yeah, so Lori asked me to talk about this. This is another project that we're working on at ADAI. It's part of the Roadmap to Recovery, which is from the Healthcare Authority. So Healthcare Authority, or HCA, received a research and planning grant from CMS, Centers for Medicare and Medicaid. And at the end of the grant, the Healthcare Authority will have a report called the Roadmap to Recovery. And the goal is really focused on Medicaid providers to be able to provide the full spectrum of services needed to serve people with substance use disorder, rather than the current model, which is provide a service, bill for it, and then provide another service, bill for it. So what does the full spectrum look like? And this work aligns with the Medicaid waiver, which is what has stood up the Accountable Communities of Health, the OCH in your region, the State Opioid Response Plan, and the Blake Bill, or 5476. So ADI is contracted with the Healthcare Authority, and we're conducting a SWOT, strengths, weaknesses, opportunities, and threats. So an environmental scan to look at system level innovations, gaps, and opportunities. And again, this is across the full spectrum of services for serving people with substance use disorder, from harm reduction to treatment to recovery supports. And some of the questions we're asking people are about services, and some are about the financial aspects of providing SUD services. And we aren't asking people to share their personal stories or any protected health information, but really from their different perspectives and experiences, what does it look like in their region, gaps, needs, innovations, successes. So far, we've talked to many of the accountable communities of health, most of the behavioral health administrative services organizations, and we're now talking to service providers at the administrative, clinical supervision, and direct provider level. So for the people that we're talking to, your role is to be a voice for those you care about and serve, help us understand the needs of your regions, also the opportunities, barriers, and innovations, and any documents that might help support this. The end goal is an alternative payment model. Thank you. And we're really trying to look at this from a system-wide level. So healthcare systems, payers, Indian healthcare providers, children, youth, and families, Healthcare Authority, harm reduction, community-based organizations, which isn't, it was pointed out to us that this isn't in this matrix, so we need to update that. And Lori just wanted me to let you know that this is work that we're doing, and we are working. Okay, I'm done with the slides, Lori.
Okay, I'm throwing that one up there quick.
Oh, great. So before I talk about this, we're currently talking to people in your region, and those include behavioral health agencies, OTPs, housing providers. So if there are people, providers in your region that, and SUD providers that you think we should talk to, please let me know. And then that last slide, Lori, thank you, is the upcoming Transforming Our Community, Sharing Innovations for Reducing Harms for People Who Use Drugs, which is June 7th and June 8th. So less than a month away, which is crazy. It's 8:30 to 12:30 or 8:30 to noon. And actually we're wrapping up the formal part of it at 11:30 and leaving the last half hour for people to hang back and network informally if they want to, kind of like you would at a real conference when you're having the last of your snacks and check in with each other. And Lori, like you always left time for when we met in person.
Thank you so much, Lisa. I am realizing more and more, it feels like, particularly since I've come back up for air after spending a lot of time putting together the proposal that we submitted to HRSA back in mid-April, that there is a lot going on both region-wide and statewide that would be good for us to be connected to. So you see me trying in this meeting to do a little bit of introducing some of those linkages so that we can start, we could be very informed at our own level and understand how what we're doing could interact with what's going on at these other levels. Any questions of Lisa before we move on? Okay, I'm going to go. Thank you, Lisa. I'm going to go forward quickly and give you just an overview of a few things. And then I think I saw James Kennedy come on and I was really happy to see. Oh, yes, there he is. Okay, so he's going to be in this little section as well, even though I didn't put him on the agenda. One of the things that I submitted at the end of April were some reports to HRSA about all of the projects that we had committed to doing when we got this funding and giving them an update sort of on what we'd accomplished and what we thought were the challenges and opportunities around what we still have to accomplish. And so I thought it might be useful just to give you a quick overview of so for this grant, we were given money to look at prevention, treatment, and recovery. And there were several activities that we had to do in each of those areas. And the way I took a run at getting that money was to say we had these various projects that as a collaborative group of agencies and service providers, we would try to accomplish over the course of the 3 years that we have the grant. The first project that we outlined was this integration of behavioral health therapy provider and MAP prescription. And I think we can give that a solid check off with Safe Harbor and Discovery Behavioral Health coming together. Now we definitely have that integration happening. So that was a big project. And I want to thank all of the people who made that happen over the course of the last year and a half or so. We took off the Exploring the Crisis Stabilization Center feasibility, kind of decided it wasn't feasible, and definitely during the pandemic, there was no way we were going to make progress on that front. And the HRSA organization who funds us was okay with us taking that off the list because we had such a thorough set of projects that we were doing outside of that. We developed and we do maintain an online and a printed resource directory. Those yellow cards are all over the place. And if you need more, please let me know. We're happy to get you a supply. The jail to community service connection, generally both Gabby at Believe in Recovery and maybe to some extent DVH, I'm not sure, helps with that jail to community service. I know Gabby is looking at or handles the RSAT program in the jail, and that has an aftercare component. So we were able to give that one a good check. The funding of Recovery Cafe, you all heard all of the good work that Brian Richardson and the Recovery Cafe team is doing. So I think this community really does, we're so fortunate to have a place where our recovering community can all come together. And when I say recovering from everything, I'm thinking I'm going to go there on crutches this week and do my own little recovery connecting. And then extending harm reduction program services into South County. We'll talk about that a little bit more here in a second. You can see I've given it a yellow check. It's not done, but I feel like we're on our way to ramping up to something really productive in that area. Anya is helping us with our communication education integration efforts to address stigma both at this local level and also at the regional level. Somewhere in our slides, you will see a link to a video that OCH made that features, Anya can tell you who she spoke with, but it's Anya and another person talking about stigma. And it's a really good video, and I'm not going to make you watch it in this meeting, but the link is there if you want to go watch it yourself. And then the coordinating and optimizing navigator and care coordination services. I'm giving that a yellow check because of how much work is going on right now with the REAL program. And I think that one of the things that comes out of that will be that better coordination and optimization. We can't put a blue check mark by it, but I feel like we're well on our way. And we have until August of 2023 to report something concrete. So I think we've got time to make something happen there. The last thing is a project that I've been humbled with all of my great ideas about what we would do back when I wrote this grant. This collective case management for high utilizers had a real gateway thing that was needed, and that was two-way communication or technological pipes that could go between all of us so that we could keep on top of where our client was and making sure we weren't losing them in the cracks. And I will tell you something that came up on that topic at the OCH board meeting, which was just this last Monday. And I'm really grateful that I go to that because I learn a lot that I actually don't hear about otherwise. They had attend this meeting. So their board members are there. And this is a group that, is made up, some of you are on it, is made up of a lot of service providers and agencies. They'd invited HCA's policy deputy director, Michael Arness, to talk about or take some very pointed questions about the 115 waiver renewal, which some people are calling MTP 2.0. And I want to tell you, I know nothing and barely held on to the conversational tow rope behind a very fast moving boat during that meeting. But I did take some very careful notes. And when we think about the fact that for that last project that I really can't report any progress made on, the idea of the digital communication and what we would agree to as a whole realm of service providers here, not just in Jefferson County, but throughout the region. I knew that this was something that OCH was at least looking at and that the state was looking at, and it seemed to make sense to sort of wait and see how things shook out before we tried to press forward on any front. In fact, we couldn't do anything to press forward on any of those fronts until that digital communication piece is settled. What I learned was, again, something I don't know a lot about, but that in this 2.0 version of the 115 waiver renewal, they're very much focused more on community-based organizations. And so from the perspective of the folks who are sitting around the OCH table, there is a concern that there isn't going to be enough support for the projects that they all started over the past however many years it's been for MTP 1.0. And to have sort of the idea of moving to community-based organizations and trying to figure out the digital communications, what is the recommendation going to be, seemed a little bit backwards. So it was it was an interesting conversation. Again, I'm saying I don't know a lot about it. And to that end, for our next meeting, I have invited, her name is Siobhan Brown. She's from the Community Health Plan of Washington. And I've asked her to come and give us an overview of this MTP 2.0 and the ways that it might impact community-based organizations and what its focus is and maybe what its challenges is. I spoke with Sheriff Knoll about the fact that in this new version, jails might actually be billing Medicaid. And what does that mean? Because that's a whole different workflow for everybody. So I hope I'm bringing somebody in for our next meeting that's going to be useful. I think it'll be useful to me. I hope it's useful to you. And hopefully we will learn more so that we can then coalesce questions that come from a little bit more insight than what I'm currently bringing to the table. Are there any questions or anything that somebody would like to add on that topic? Sheriff Knoll, I welcome anything you know from the jail perspective, or I'm looking to see if Dave Fertino is here.
Yeah, just you know, if there was some way that Medicaid could be billed, I don't know if people know, but when an inmate comes to jail, they lose all their outside, like Medicaid, Social Security, it all goes away. And then the county, they're the jail, you know, we're responsible for paying the doctor bills that the hospital, to my understanding, writes off 50%. So anyway, this would be a good thing for the community. It'd be a good thing for the people, I think, that they don't have to lose their benefits and then reestablish them when they get out. I talked to our corrections superintendent, David Fertino, earlier today about it. He thinks it would be pretty seamless as far as the reporting goes. Apparently now what happens is if someone comes to the jail, the jail fills out forms that go to WASPIC, which is the Washington State Association of Sheriffs and Police Chiefs, who is somehow, but for the state administers letting the proper people know when someone goes into custody. One thing David thought was that this, if the funds were available, it would be, he'd heard that it was for 30 days, which at least, but it makes sense because sometimes someone could be in jail 2 days and lose their benefits and then get out and have to figure out what to do. So I think it would be a good thing. I was surprised that I don't know how that all works, but it seemed like a double penalty. If you go to jail, you lose your these things that you depend on. So yeah, I'm excited to hear more about it and see how it might work.
Well, thank you. I appreciate you guys listening. As I told you, very little, but look forward to knowing something more. And please come with questions if you are more informed and have questions that can be brought to the table for Siobhan at our next meeting. And then our next topic I put in here, now therapeutic courts wasn't something that we listed as a project when we went after this grant, but certainly in the course of the time, I appreciate how much the therapeutic courts has been looking at their programs and what they can be doing. I have something here that James Kennedy put together in case he couldn't be here, but since he is, I'm going to invite him to just sort of give us a little bit of a synopsis of what's going on that front at the therapeutic courts.
Yeah, so we've had a part-time drug court coordinator basically from its inception until about a year ago. Our behavioral health court hasn't really had a dedicated coordinator. The district court coordinator basically has served as the coordinator for behavioral health court. And having no involvement with family therapeutic court, I'm not exactly sure who coordinated that, but I think it might have also been the person who was our part-time drug court coordinator. So anyway, we don't have any coordinator right now in drug court and no overall coordinator for our therapeutic courts. And so we are trying to create that position. It is something that many other counties in the state of Washington do. So that way we can have an overall program that is set up that we could be looking at best practices and actually have some method to our madness and how we set up and execute this program. And it became quite clear to me last year as we were trying to update our protocols for the first time since inception, that we really needed a coordinator whose input was necessary for this. And frankly, the updating and drafting and maintaining the protocols is typically the job of the coordinator. So anyway, we have been working towards trying to create that position. We do have a dedicated revenue stream in Jefferson County for therapeutic courts, and it is our 1/10% fund. However, the therapeutic courts have not really tapped into that fund very much over the years. And we're hoping that the committee that advises on that fund will fund this position. We aren't really seeking grant money for it because we want people who we can employ and retain long-term. We don't want to bring someone out to Jefferson County with the promise that they're going to have a job for a year and maybe we'll get to have it renewed in the next following year. So this is money that's really meant for therapeutic courts, and we're hoping that the committee will choose to fund it. It is absolutely necessary going forward to have a comprehensive and thoughtful therapeutic court program. And we're hopeful that once that person's in that position, that they would be able to actually maybe even look and find other grants for therapeutic courts to bring in added revenue. And I hate to use the old military term, but be a force multiplier for our therapeutic courts. And so they're going to vote on that tomorrow, and I'm hoping that they will pass it.
Well, great. We'll be crossing our fingers for you, because I know that it will add such an efficiency. And as you say, an opportunity to expand what's going on there. Does anybody have questions for James? Okay, I'm going to go back and give you then to the slides, give you just a quick overview of what we're doing on the South County harm reduction front. We sort of have two major things that we're looking at. One is the exploration of a vending machine for harm reduction supplies that would be located at the Brennan Community Center site. There's, of course, a lot to clarify. Jim Novelli and Denise Banker have been working with us to clarify budget, how those technology pieces are going to work together, who's going to own what piece of it, you know, who will stock it, and the timeline to get all of this done. So that is a project that I know is going to take some time, but I really appreciate that community coming together on a regular basis to see how we can move it forward. And then the second piece is exploring the mobile harm reduction service integration. I think Gabby is on here and has given you folks an overview of some of her plans, hers and Believe in Recoveries and Olympic Peninsula Health Services, OPHS, the work that they're doing to try to bring mobile harm reduction services to Jefferson County. And at our next meeting, we will be looking at, Gabby's going to come and talk with the community about some of these things that you see listed here, both their operational model and what does that look like, how it will be integrated with, you know, EMS and public health and the community, and how we'll engage and create an awareness and an acceptance with the community about the work that we're bringing to their specific location. So good stuff happening on the harm reduction front. And I'm just going to take you back to this slide quickly right here. So what I want to leave you with is we have done a great deal as a group. No one of us has done it, but I think collectively we have really made progress on what was an ambitious agenda for the grant money that we got. And I want to thank you all for all of the help, all of the brainstorming, all of the brilliance that you brought to making it happen. Bringing it on down to Anya.
Lori, can I just interject real quick? I think I agree with you. It is amazing to watch a team work so well. As a relative newcomer to the team, though, teams have natural leaders, and you have been a natural leader that has brought a lot of us together to do this work. So thank you very much for your leadership.
Thank you. Thank you. It's been good people to be working with. Maybe we'll get another grant. We'll be able to do it for a little while longer. Okay, I'm going to pass the next piece of the program over to Anya to talk to us a bit about education and outreach. And I should tell you just at the top of that I am working on developing another contract. We had a very small budget for the first bit of work that Anya's done for us. And now that we see that it works well, I'd like to create a contract that covers the realm of what we'll be doing between now and the end of the grant. So I'll bring you budget and specific scope, but one of the things she'll cover are some of the things that we're thinking about doing between now and the end. And Anya, I just want to say how much I appreciate your leadership on this front, because it's only getting done because you're here. Okay, go ahead, Anya.
Thank you, Lori. Well, first I wanted to give a quick report back, if you could go to the next slide, from our drug take back event that we did 2 weekends ago. So as many of you know, this is a biannual event that the Empowered Teens Coalitions do in Port Townsend, Port Hadlock, and Quilcene. So we did a soft launch with combining the Naloxone kit distribution with the drug take back event and the medicine lock boxes that they distribute. It was a successful event. I was sitting with Holly Gum and Sheriff Knoll and my friend Amelia, who's a nurse, and we had positive reception from the folks in Quilcene. Many people already had naloxone or were familiar with the medicine. Folks who weren't familiar were open to learning about it with us and taking some boxes home for people who worked in bars or schools, taking a box so they could keep it at their place of work. Overall, we distributed 11 naloxone kits, and we used the style of naloxone kit that Dr. Carlbaum makes for the East Jefferson Fire Rescue. So thank you, Dr. Carlbaum, for advising us on how to have those comprehensive kits made. I want to invite Sheriff Knoll, if you have anything you want to add to giving feedback or overview from the event.
Yeah, I just wanted to add earlier when I talked about that, I'm sorry, I felt I left you out. I forgot about the naloxone kits, and but it was interesting meeting with people to ask about it. Most people's response was, "Oh, I don't need one of those," and I wasn't thinking on how to counteract that, but Anya, and I forget the name of the other woman that was there with her, you know, the idea that, well, you might see someone that needs it or whatever. And so that really, it was nice, because as soon as, you know, I felt like the game of the day was kind of like how to sell these kits to people. And of course they were all free, but just the idea that, you know, we were saying it's like the modern day first aid kit extension that everyone should carry. So, so yeah, that was a nice addition to the drug take back. And 11 kits is big, because I think we only had 4 people come to drop off meds. It's, you know, that this was the second year we've done it in Quilcene, and but that was good. And it's one thing I think is really nice is getting out down to the South County and including them in all these things that we do, which is really good. So and you know, again, thanks to the chief for letting us use his space there. But yeah, good job.
Awesome. Thank you, Sheriff Nolan. Thank you, Chief McKern. That was a great talking point that we had, that this is the modern update to your medical kit. That drug overdose is the, you know, one of a leading killer for folks under 50. So it's really important that even if you don't live in a house with chronic substance use, that folks still know how to to administer this medication and know how to access it. So we're excited about hopefully being able to do some more naloxone kit education and distribution. Would definitely want to partner with the Empowered Teams Coalition again, and talking about the potential of expanding to all 3 of the drug take back locations at the October event. So I hope to be in communication with Holly and with Lindsay and the gentleman from Quilcene, whose name I'm forgetting in this moment, to see if we can collaborate and expand that natural partnership of education and prevention. Lori included a link here in the bottom of this slide to a video that I did with the Olympic Community of Health on stigma and substance use disorder, with Brian Burwell, who's a substance use disorder counselor with the Suquamish tribe. So if you haven't seen it yet and you want to take a look at that, I definitely invite you to do that. This brings back to some conversation that I was having with Sheriff Knoll during our lovely 4 hours tabling on Saturday, talking about how important language is when we're working with people who use drugs and trying to create a stigma-free environment. So talking about person first language, calling people who use drugs, people with substance use disorders, and avoiding language like drug abuse, junkies, and addicts, and things like that. We can go to the next slide. Thank you.
Yeah, thanks for the reminder. I learned about people first language. So, and now it's my, I don't know if game's the right word, but I try to look for every opportunity I can now to try to phrase things that way. So thanks for that.
Wonderful. And studies do show that using this destigmatizing language really does increase patients' access to services and care. So it's not just about being kind and compassionate, which is also so important, but it's actually about expanding our access to care and treatment as well.
I just wanted to say that it's not like, at least for myself, not like I mean anything bad by saying stuff the other way, but what I mean was that, but you don't say it like that. And, you know, putting the people with some whatever, it makes a difference.
Absolutely. So looking at upcoming overdose education and outreach opportunities, the Quilcene Empowered Teens Coalition has invited me to come to the Quilcene High School Show Us Your Community resource event next Friday. So I'm going to be there with the 9 kits I have left over from 2 weekends ago to distribute to folks. And then looking at some upcoming opportunities, we're not committed to tabling at all of these events, but I wanted to share these with the Behavioral Health Coalition here in case there were other organizations that were interested in teaming up and maybe doing some work together or having a table at some of these upcoming events that seemed like great opportunities to get out into the community and to be doing some education. So we have the Show Us Your Community event. There's a LGBTQIA Pride event in Port Townsend in June, the 4th of July celebration at Fort Worden, lots of farmers markets this summer. I'm really excited about the International Overdose Awareness Day, which is August 31st. That's something that, to my knowledge, Jefferson County hasn't honored in an organized way in the past. I've been attending some Peninsula harm reduction meetings with a lot of folks who do work in Kitsap, and Kitsap County has had a handful of successful overdose awareness days in the past. So I'd be really excited about teaming up with some folks here if other folks are interested. I'm thinking potentially some sort of vigil, maybe in downtown PT or the Cotton Building, maybe some kind of walk. We know that overdose is unfortunately just getting worse, as we've seen with recent CDC reports. And so I think these kinds of days are really wonderful opportunities to show families like my own that we're not alone, and a lot of folks are grieving and want to take action to end this preventable epidemic. And then we've got the Wooden Boat Festival. And I also wanted to highlight some asks for ongoing opportunities for community naloxone training. I know from a friend who works with the Public Defender's Office that Ocean from Jefferson County Public Health recently came and did a wonderful training for folks at their office, and someone from their office reached back out to me and asked if there were more opportunities for community training. So would love to continue to collaborate with folks here and talk to folks at the Public Health Department to see how we can get some more of these trainings out to people in our community. Let's see, and then I included a couple articles. There was a new CDC report that recently came out that's estimating the increase in overdose deaths nationwide to be 15%, and here in Washington, an increase of 30% from the last year. And also highlighting that we're seeing fentanyl coming into our schools and coming into our high schools and middle schools, with the use of fentanyl really commonly in pressed pills right now. And so that's why I think this opportunity to partner with organizations or with projects like the Empowered Teens Coalition are so important, because doing that early intervention and prevention can really save lives. There you go. That's all I have. If anybody wants to chirp in or has any feedback or ideas for some of the slides I've shared, we might have a couple minutes for a conversation. Is that right, Lori?
Yeah. Is there anybody who can think of a place that we might target for maybe trying to do a naloxone education? I think it's nice to raise the profile of the fact that it's available just by doing it maybe amongst our offices in places that we haven't already done it. I don't know if I'm sure the sheriff's office has already done it. Brian, I see you.
Well, yeah, I was just gonna say, I would love something like that here. I know Leanne with Real Team next month is going to be presenting on harm reduction, and she's bringing in someone to talk about naloxone, but the more the better, and we're super open to hosting something like that here.
Awesome.
Okay, great.
Could I ask the sheriff and the chiefs, are there any particular locations where you see higher numbers of overdoses? Or other communities that you see higher numbers of overdoses?
Yeah, go ahead, Tim.
Sorry, Sheriff, I didn't mean to cut you off there. Are you seeing more than I am? I don't have it in any one particular area. The south end, unless Chief Manley's leading it way down in Brennan.
Seems to me that most of them that I'm aware of have been up north, and primarily, and I could be totally wrong, but it seems like Port Townsend has the most. And I know we've had some in Hadlock, but
You know what I wondered? I know that there, for instance, I can't remember if it's on Thursdays or what day, but there is a faith-based group that provides a lunch over by the lagoon for folks who have unstable housing. And I wonder if that would be an opportunity to just sort of hang out there and, you know, see if we could do a little bit of at least developing rapport with community, even if they are not interested in the naloxone. It might be a place to start. Are there places other than the Kaitai Lagoon?
Just remember, folks, when we start to have larger events, like we have a gravel event coming up pretty quick, and we've got a number of events. We're a community that, because people like to come here and they like to stay here. And so I know we have a number of larger music events coming up really quickly, 2 back-to-back in August. That'll be up off the Munn Road. I think those are areas that we're probably going to encounter some folks that are going to come in, and I think it's going to kind of tax the EMS folks and the police folks a little bit, but just want to keep us on the radar that that event's out there, and there's a couple, 2 or 3 of them coming up pretty quick. So
Yeah, I think that, you know, I've been thinking that since we were down there at the drug take back, you know, where these could happen. And one thing I was thinking, like, you know, the Quilcene Fair and having a booth, it just seems like there should be a booth at everything that has booths, that you guys should be there, not only handing the kits out, but, you know, making it seem more normal, if you want to say, and educating people about it. Because to me, it's such an easy way to save someone's life. I mean, it's like, you don't even really have to think.
And tell you that anytime somebody with a uniform, sheriff or fire, has a conversation and hands it out, it gives it an elevated sense of acceptability, I think. So in the places that we can overlap, or what do we call coordinate, so that maybe we, you know, it's not even that you have to be there for 4 hours, but there's a half hour, you know, where there's maybe an overlap of, we get a deputy or somebody from the fire department teamed up with Anya. That might be good.
No, and I agree. And I thought that's what was nice down in Quill. I mean, and I think what you're saying is it's like law enforcement approved. It's not advocating drug use or anything.
Exactly.
It's just addressing a known fact that can happen. And so,
good.
yeah, I think you should be everywhere all the time. And
Dr. Caldwell.
I was also going to mention, I think Anya and Lori are too polite to say that they're just 2 humans. And I would love if we could replicate everybody everywhere all the time, but it sounds like they're going to need some commitment from us. And so I don't know if there's a way to create like a asynchronous way to know where and when events are in your plan, and let us know, and we can sign up like on an online spreadsheet or something. You know, some of those events I might be able to attend, like the Pride event. I would love to come to that, especially if there's a parade. And so, and I think I'm off that day, so be happy to be there. If you think I should bring a white coat, I never wear one, but if you want me to bring a white coat,
Stethoscope and and one of those hats that they wore in Curious George that the doctor wore.
he has to have one of those round, shiny things.
Exactly. Because that's how old we are, Sheriff Knoll. Okay, I know we're coming up on 4 o'clock. Is there anything else anybody wanted to say before I let you all go? Sorry, I realized I could have shut off this slide ages ago. Okay, thank you so much for being here and all of your contribution, and I'll look forward to talking to you between now and the next meeting. Go forth, do well. Thank you.
See everyone.